This is all very exciting for me, and the progress in the past 6 months, I think, in knee replacements have been phenomenal compared to the last few years. We have a lot of things we do before we recommend surgery, including lubricant injections and cortisone injections and therapy and bracing. But ultimately the patient it's a significant limitation of their lifestyle. So at that point, the decision for surgery is made. One of the common misnomers in a knee is patients come in the office, they say, oh, you take the knee here and you take the knee here and you put this new bionic joint in there. As you can see, what we're doing in this joint is we're actually going to resurface it. So we're leaving the surrounding structures of the joint, which allow us now to resurface that joint. But in fact, most of the bone stays. I'm taking off just a very small amount of bone. Traditional knee replacements are where you cut the quadriceps muscle. You then will push the kneecap over and do the procedure. A quad sparing, you actually move the muscle over, and as the muscle moves over, it isn't cut, which means that now that muscle doesn't have to recover. So when the patient goes home or up to the surgical floor, they can get up right away and don't have to worry about muscle weakness from the muscle healing. So I found that the patients recover much quicker, have less pain because of that. With use of a navigation system, it allows me to make very precise, very small cuts in the bone. So as I do it, if I take the top bone, the femoral or the thigh bone, I'm taking just about a ½ an inch off the top of that bone and then placing the cap over the end of the bone, which now will act as a new joint surface. On the bottom bone, the tibial bone or the lower leg bone, I'm taking off a ½ an inch or less, literally off the bottom of that, and putting a plate on the bottom, which now allows that bone to have a joint surface on the bottom covered by a bearing surface. So now the ligaments all stay, and the joint is resurfaced. And so I really prefer to call it a joint resurfacing rather than a joint replacement. It is much more accurate in my opinion. Patients do better at home. Our studies show that 64% of the patients who were in the hospital 2 days told us they had good pain relief. 98% who went home said they had good pain relief. Our job is restorative to function as fast as we can. So we want them out doing therapy, out in the community, being active, essentially. You can be 92 and you can leave the hospital in 24 hours if you're ready to go, and most patients are. Even my older patients that were traditionally here for 2 or 3 days or 4 days are going to skilled nursing or to an outside facility for rehabilitation. Now at 24 hours, tell me they want to go home. I had a patient last week, at 24 hours, he was dressed, ready to go, and he was 85. And that to me is exciting. You go home and recover with your family.